Prenatal trauma and fetal alcohol syndrome. These are some of the topics that we'll be going over in this presentation. So what is fetal alcohol syndrome? The term fetal alcohol syndrome was introduced in 1973, and on the left side you'll see that we listed the diagnostic criteria that was used at that time. Professionals nowadays like to use the non-diagnostic umbrella term fetal alcohol spectrum disorders, and the reason for this is to shed light and include all of the effects and symptoms from fetal alcohol syndromes to all possible physical, behavioral, cognitive, and psychosocial effects that result from prenatal alcohol exposure. Fetal alcohol spectrum disorder is a preventable disorder caused by maternal alcohol consumption and marked by a range of physical and mental disabilities. Although recognized by the scientific and medical community as a clinical disorder, no internationally standardized diagnostic tool yet exists for fetal alcohol syndrome disorder. So what leads to fetal alcohol syndrome? Prenatal alcohol exposure, simply put, is when the mother consumes alcohol when the fetus is in utero. Alcohol can disrupt development at any stage, even before a woman knows that she is pregnant. Here on this slide, you'll see some statistics that involve prenatal exposure to alcohol and also fetal alcohol syndrome disorders. This is a nice infographic to just show the effects of fetal alcohol syndrome disorders, and we'll go more into depth in the future slides. Here on this slide, we just wanted to list two different disorders that are related to fetal alcohol syndrome disorders. How does fetal alcohol syndrome present itself in children? Some of the behavioral symptoms that have been repeatedly reported include attention deficits, hyperactivity, impulsiveness, and poor coordination. Also, some children will experience poor working memory, impaired executive functioning, and impaired social abilities. And these issues can become more apparent as the child reaches school age, where they are likely to struggle with academic and social demands. Some physical presentation include epicanthal folds, referring to eye shape, an extra ridge on their outer ears, fingers that will be curving away from the thumb, a lower nasal bridge, as well as what is called hockey stick palm crease. There are long-term effects of fetal alcohol syndrome, and you'll see some of the symptoms here on these infographics. You may notice that a lot of these symptoms are similar to the ones that affect children. This just shows that the symptoms do not get better with age. It is possible that a compounding relationship exists between trauma and fetal alcohol syndrome. When children are exposed to both trauma and prenatal alcohol exposure, they are more likely to have more severe developmental deficits than expected than following just a single exposure of either prenatal alcohol exposure or trauma alone. There is some evidence that shows a history of prenatal alcohol exposure or trauma can potentially cause permanent brain damage. This can cause even more problems with speech and language, attention, intelligence, memory, and emotional and behavioral issues. There was a survey conducted by the CDC where they asked over 1,000 professionals how prepared they were to identify children with fetal alcohol syndrome or other alcohol-related disorders. And in this pie chart, you'll see the level of preparedness and percentages. Prenatal alcohol exposure is a key public health issue with a potential negative impact on child and adolescent health. Staying informed about prenatal alcohol exposure and the spectrum of fetal alcohol syndrome disorders is the best thing you can do to support women and children's health. Our question to you is, what is one behavioral issue and one physical characteristic that is a symptom of fetal alcohol syndrome?